Hi, I'm Dr. Madhumitha, consultant dermatologist at Helios Advanced Skin Hair and Laser Clinic. You would have heard many doctors, especially dermatologists, talking a lot about sunscreens, and they stress a lot about usage of sunscreens. So we keep talking a lot about ultraviolet radiation. Amount of sunlight that reaches the earth's surface has only 3 to 7% of ultraviolet radiation, whereas it has 44% of visible light and 55% of infrared radiation. So it's not only that UV radiation leads to tanning and cause sunburns and then pigmentation. These visible light and also infrared light can cause even more harm than UV light. So it's very important to use a sunscreen to prevent tanning, to treat the existing pigmentation, to prevent the existing pigmentation from getting it too worse, and also to prevent sunburns, and also it's the best anti-aging medicine. It's the number one anti-aging medicine which should be included in your skincare. I would suggest when it comes to sunscreen, please prefer a pharmaceutical brand rather than a cosmeceutical one. This is because SPF is very important. So SPF is a measure of protection from UVB, whereas you would have seen some PA++, the star boosting, that is meant for UVA protection. And only certain sunscreens in the market provide protection against visible light and infrared light. So it's very important to choose the right sunscreen. Suppose if you're a person who is working in software, who is exposed to a lot of blue light from gadgets, it's very important to use a sunscreen with blue light protection and infrared light protection. So there are something called tinted sunscreens. So these tinted sunscreens are the one with iron oxides, where the color is like a foundation or a concealer. It looks like that. So these can provide protection against visible light and infrared light. So many people talk about physical sunscreen, chemical sunscreen. This is a wide term. Physical sunscreens are nothing but products with zinc oxide and titanium dioxide. They just reflect the light from the surface. They don't absorb. Whereas the chemical sunscreens like avobenzone, oxybenzone, all these things absorb the sunlight. And there are certain newer advances in sunscreen where a synthetic melanin, that is a synthetically prepared melanin, is used in sunscreens. So it mimics your normal melanin and it provides protection, and it also prevents tanning. And there are certain probiotics which are added in sunscreens which are very important for people with atopic dermatitis. Suppose if you are a person who is going for swimming, or if you are a surfer, then you have to prefer a water resistant sunscreen. So these water resistant sunscreens can provide protection only for 90 to 120 minutes. So if the sunscreen is mentioned water resistant, then it can provide protection only for 80 to 90 minutes. Whereas if it is mentioned like very water resistant, then it can provide protection for some 120 minutes. And one of the groundbreaking advancements in this sunscreen is sunscreen with DNA repair. So whenever you're exposed to these lights, there is damage to DNA, and there are certain products like DNA repair enzymes which are included in these sunscreens, which facilitate the DNA repair mechanism. So if you are a person who is having skin type 1 and 2, who is prone for sunburns, too much of sunburns, and if there is any pre-malignant lesions like something that can lead to a skin cancer, then I would say you have to prefer a sunscreen with DNA repair enzyme. So what are the things you have to look for when you choose a sunscreen? Whether it is providing protection against UVB and UVA and blue light and infrared light. So if it is mentioned SPF, maybe 30 or 50, then it provides protection against UVB light, whereas PA and the star booster 3+, all this mentions its protection against UVA light. So the best sunscreen is determined by its critical wavelength. So this critical wavelength will be mentioned with the symbol lambda with 370 nanometer in the sunscreens. And then if you're a person who is working in software and all those things, prefer a sunscreen with blue light and infrared light protection. Different formulations of sunscreen like gel, mousse formulation, cream, and all these things are meant for certain type of skin. So especially in men who maintain their beard, it's better to go for gel type sunscreen. If they go for like very thick creamy or mousse type sunscreen, then it will lead to more white cast, or it might stick to the beard. It will not blend properly. So better consult a dermatologist, discuss regarding your profession, your daily routine which you are already following, and let them prescribe the best sunscreen for you. Is it necessary to apply sunscreen even when you are at home? Yes, it's necessary. As I said, not only the sunlight but also the light emitted from your gadgets, light emitted from the fluorescent lights like tube lights, all those things can also lead to damage. So no matter if you're inside or outside, that's indoor or outdoor, you have to apply a sunscreen. That should be a compulsory in your skin routine. Children from 6 months of age can use sunscreen, but there are certain sunscreens which are approved for children. Not that it's not that they can use any sunscreen. Only physical sunscreens are approved for children. And a very important thing is to reapply the sunscreen. Whatever the sunscreen is, you have to reapply it. Most of the sunscreens have action only for 3 to 4 hours, so it's better to reapply the sunscreen.